Welcome to this week's Health and Care Update about the coronavirus pandemic in Devon. While cases have been declining over recent weeks in most age groups, the exception to that being the over 80s, who we know of course are the most vulnerable, the most likely to suffer greatest and the most likely to be in hospital. The latest data does show that this decline has started to slow down and numbers are stabilising. I'd like to hand over now to my colleague Simon Chant, who can describe the data in more detail.
This is an overview of the latest national and local data on COVID-19 as of Thursday, the 10th of December. We start with the national picture. A slight increase in cases was seen over the last week following the decline in previous weeks. The number of tests has remained high with good availability. Nationally, a decline in the number of deaths was seen over the last week. In terms of the picture in Devon, there were 607 COVID-19 cases and 24 deaths reported in the last week. Rates are below the national average. Case rates were slightly higher in East and West Devon. Whilst cases have been declining since mid-November, the decline has started to slow and case numbers are starting to stabilise. The breakdown by age group reveals that the highest case rates are still in over 80s, although rates have stabilised over the last week. The data in this summary is drawn from Devon's COVID-19 dashboard and the National Coronavirus Tracker. The latest available information is accessible through these links.
Thanks, Simon. So what this means is that it's absolutely vital now that we continue to do all we can to ensure the rates do not rise over the coming weeks. Testing capacity in Devon remains really high. Over 15 or 16,000 people who have symptoms are being tested every single week in Devon, and the positivity rates are coming down. If you do have symptoms, I urge you please isolate and get a test as quick as you can. We're also testing people who have no symptoms. The university have worked really hard over the last week or so, testing students who have no symptoms as part of their programme to support students to go home for the Christmas period. Over 6,000 students have been tested in less than 10 days. Please follow the Tier 2 guidance. Do not meet up indoors with anyone not in your household or bubble. And please remember at all times to maintain your social distance, wear face coverings when you're indoors in a public space, and please wash your hands regularly. Now I'd like to hand over to Dr. Paul Johnson of NHS Devon CCG.
So thanks to all your hard work in your local communities and to our incredible health and care staff, we are seeing the rate of coronavirus cases starting to slow down. And as a result, our hospitals are also starting to see lower numbers of people, both on their general wards and in intensive care. This is really good news, but we mustn't get complacent because the virus is still here. It's still infecting people. People are still getting ill and still having to go to hospital. We still need to take it seriously. And that's why it's really important to continue doing the simple things. Maintain distance from others, wear a mask in public, and wash your hands regularly. So this week marked a turning point for us in our fight against coronavirus because the first COVID-19 vaccinations were available for our local people. 81-year-old Kathleen Viney from Plymouth was one of the first people in the county to receive the vaccine on Tuesday. And she's one of many people who will be first in line for the vaccine as we focus on those people aged over 80 who are most at risk. So in the hospitals, those people in that age group who are attending for an outpatient will be given the opportunity to have the vaccination, as will those who are being discharged home after a hospital stay. And the hospital will also start inviting people over 80 in for a vaccination. And it'll also be working with care home providers to make sure that we have the opportunity to vaccinate their staff so that they can continue working with the most vulnerable of our population in a safe way. Any appointments that we have available, any vaccines that we have available that aren't used for these groups will be used for healthcare workers, particularly those at highest risk of serious illness from the virus, but also those who will be caring for and so coming into contact with patients at most risk. Now, all those who get vaccinated will need a booster dose 21 days later, and we will make sure that they receive that. There are challenges with this vaccine. It's complex to move, to store and to prepare, and that's why initially we're giving it from the hospitals, but there are plans to make sure that we make it available through our GP practices so that people in the wider communities can benefit from it. A small number of GP-led services will be ready to start from next week, and more practices will also join during December and in the coming months. We're also looking at developing large vaccination centres available to treat large numbers of patients in sporting venues or conference centres, and they will be ready and will be stood up once we have a larger supply of the vaccine. You've heard it said that this is a marathon and not a sprint, and it will take many months to vaccinate everybody who needs it. And that's why we can't stop doing the important things. That's why what we do in our day-to-day lives is as important as rolling out this vaccine. So our message to you is, don't contact the NHS to seek a vaccine, because we will let you know when we have it available for you, and we will make sure that those at highest risk get vaccinated first. And when the NHS does contact you, come and attend your appointments, whether that's for the vaccine or that's for your routine care. And in the meantime, don't let your guard down. Continue to wear that face mask, continue to keep your space, and continue to wash your hands regularly, keeping yourself, your family, and your community safe.